Welcome to another episode of What is Hashimoto's with Dr. Martin Rutherford. To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com. And now, here's Dr. Rutherford.
Did your doctor miss your Hashimoto's diagnosis? Yeah, I don't know. I'm seeing this a lot lately. I've been seeing a lot for ever since I've been doing this, for sure. And I'm still surprised at how little the understanding of Hashimoto's has not trickled, and I use the word trickled, not trickled down into the endocrinology field or the medical field yet. I see bits and pieces of it getting in there. I see more people testing for it. But the answer is yes. I mean, you go to the doctor, okay, and the doctor is on a time schedule. Very few are not. I mean, if they're taking your insurance, they're on a time schedule, just for the record, okay? Because they have to see so many patients and they have to do their notes. And so they're gonna look at your thyroid symptoms. They may not be familiar with the fact that you have thyroid symptoms. Here's the typical medical model for Hashimoto's. You go to the doctor and they don't know that you have Hashimoto's, so they treat you for all the symptoms. So they give you a medication for anxiety because they don't look for it. They may not be familiar with all the symptoms. Maybe they run a panel for thyroid. Maybe they don't even run a thyroid panel because they don't get yet that these are thyroid symptoms. I see this all the time. And then they treat all the other symptoms. They give you something for your constipation, and they give you something for your anxiety, and they give you something for the fibromyalgia pain that you might be developing from it, and maybe they give you something for your headache and your migraine and all these things. So they're literally treating all of the different symptoms of one problem with a lot of different drugs. So that's number one. Number two, they may be familiar with it. There are more doctors, in all fairness, becoming more and more familiar with it, and ultimately they I'm sorry to laugh. They test for it, and then they find it, and then it's off to the races. I mean, I've heard so many things just in the last couple of weeks. I've heard, well, your thyroid antibodies are 600, and but it doesn't really mean anything. You seem to be, just your TSH is off. I'll give you thyroid hormone medication, and we'll watch it. Your thyroid peroxidase enzyme should be like under 9. And if they're not, you have Hashimoto's, and now you have an autoimmune problem, and now that needs to be addressed. A lot of doctors will say there's nothing you can do about it. We're just going to let you go. But that's really not diagnosing it. But that's them diagnosing it and not knowing what to do about it. The next biggest thing that causes a not diagnosis is all your blood tests are normal. Okay. My TSH is normal. They haven't even looked for Hashimoto's. My TSH is normal. I have all the symptoms. My labs are normal. What the heck is going on? Here's what's usually going on, okay? And here's what your doctor doesn't understand. So when your thyroid is getting attacked by your immune system and it's beating it up, it damages tissue, all right? It literally damages your thyroid tissue. It breaks it down. It annihilates it. If you ever saw if you have Hashimoto's, don't have anybody do show you a biopsy of one of these things after somebody's passed away. I mean, it is like gone by that time, if they've had it for like 35 years and nobody diagnosed them with it. So it's continually being damaged. The key is to stop the damage. As that damage is occurring, cells, thyrocytes, thyroid cells from your thyroid are getting damaged, and they're leaving your thyroid. And where are they going? They're going into your bloodstream. Well, when they go into your bloodstream, they take thyroid hormone with them. They take your T3 and T4. They take your hormone with them. That hormone goes in your bloodstream. Now, your brain doesn't know whether that thyroid hormone is coming from a thyroid medication. It doesn't know where it's coming from. It just knows you have plenty of thyroid hormone. Okay, so while your thyroid is being broken down, at the same time it's telling your brain that you have enough thyroid hormone. If you don't have enough, your thyroid stimulating hormone, the TSH that they all look at, if you don't have enough, your thyroid stimulating hormone is going to go high because it's telling your thyroid, it's stimulating your thyroid to make more thyroid hormone. Well, guess what? When you have a lot of thyroid hormone, because the thyroid's being damaged, okay, it's going into your system, your brain's going, we got plenty. We don't have to send any thyroid stimulating hormone down there. And so your thyroid stimulating hormone is normal. So why do you still have thyroid symptoms when your lab tests are normal? So those are the two biggest reasons that they misdiagnose. They don't know, they don't look. But the other one is they look at you and your labs are normal. And the other one is that they just don't run the antibodies is why they don't diagnose. They run they just run the whole hormone panel and they don't run the antibodies. And the reason they don't run the antibodies is they either don't know what to do with it, they don't want to deal with it, they just don't know. They just don't know. And in the end they would still just give you a thyroid medication if your numbers weren't normal. And I could go on, but as far as diagnosis, they don't look for it, or the numbers are normal, and they don't understand that you could still have Hashimoto's, and so the numbers are normal, and they don't go further looking into it. And it's misdiagnosed all the time. It's misdiagnosed all the time. I have people coming in here all day long who have 20 out of 20 symptoms of Hashimoto's. And I ask them if they have a thyroid problem. They go, well, no, I was thinking about it. My mother's got a thyroid problem. My sister's got a thyroid problem. My aunt's got a thyroid problem. My grandma had a thyroid problem. But the doctor didn't think I had a thyroid problem because all my lab tests were normal. So it's missed a lot. And those are the reasons why.
Thank you for joining us for another episode of What is Hashimoto's? To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com.